My name is Dr. Scott Fetherston, and I am a veterinarian who has a practice limited to surgery. It is a mobile-based practice in Northern California. I service about 60 referring veterinarians and provide primarily orthopedic surgery and consultation in those practices in a primary care setting. I'll typically travel to 1 to 2 practices to perform 2 to 3 procedures. Most of those days have 1 to 2 elective tibial plateau leveling osteotomy surgeries, and the remaining of the days have perhaps a trauma case or soft tissue case. So my practice, as I said, is primarily focused around orthopedic surgery. So the vast majority of that is tibial plateau leveling osteotomy surgery, corrective osteotomy surgery for angular limb deformity, trauma surgery, so comprehensive fracture repair, arthroscopy, joint fusion, medial patelloluxation, hip surgery, etc. I also do a small amount of soft tissue surgery, so brachiocephalic obstructive airway surgery, as well as jaw trauma and some dental work. So my top procedure is the tibial plateau leveling osteotomy surgery to address a cranial cruciate ligament deficient stifle. In that procedure, in my practice, we do that what's called a minimally invasive TPLO. So with the addition of arthroscopy and a limited approach to the surgical site, we minimize the tissue trauma and increase the rate of healing. In order to close that limited approach, there are multiple tissue layers that all require different types of suture. We do reach in each type of suture for a plus material, which is important in our practice, in an attempt to further lower the possibility in a high-risk surgery of infection. So typically that's a closure of the fascial layer with a polydioxanone product or the WebMax Plus, and the subdermal tissues with a PGCL or the MonoWeb material. I select taper needles primarily for those procedures, and those are in the 2/0 and 3/0 size ranges. So I love the addition of Cobra Black needles. Cobra Black needles are a highly innovative solution that on their surface seem very simple, but by chemically etching the needle to create a black needle allows for better visibility, especially in highlight situations where I might be wearing a headlight and working in the oral cavity. So it's the same exceptional sharpness and ductility, that high quality needle that we expect on the Fetherson suture with a black chemical etching. This needle, as I said, plays an important role in oral surgery and dentistry as it allows the needle to stand out from the tissue. So I use this in dental procedures as well as brachiocephalic obstructive airway surgery for long palate suturing. I find that this is a great addition to exposure and lighting. And as we pay attention to those other details, it's important to pay attention to the suture type and needle as well. I would say that suture, so the most important thing in suture is trust. And when we're trying a suture, the most important thing is to put it in your hands. So it's not possible to watch a video or read a brochure about a suture and get a feel for its quality. So I would encourage any veterinarian to get their hands on some product, get a needle driver out, and pull the suture off the racetrack packaging and give it a try. Just give it a feel, see how it performs in your hands. And I'm confident that you'll see the quality right out of the package with this product.